Imagine walking into a hospital and there's no waiting line, no frustration, no paperwork, no guessing. A soft voice greets you, gently calling your name. And it's not a human, it's an AI doctor that already knows your symptoms, your medical history, and the best treatment options, even before you sit down. I know it sounds shocking, maybe even a little uncomfortable, but this is the future that's unfolding right in front of us. And if you've ever felt ignored during a checkup, misdiagnosed, or scared that something might be wrong, then what you're about to hear might give you hope, and maybe a few chills. We're living in a world where technology is rewriting every industry, and healthcare, the place we trust with our lives, is changing faster than most people realize. After years of watching how hospitals operate, how patients struggle for answers, and how doctors fight burnout, I can tell you this with certainty. AI doctors aren't coming someday. They're already here. The only question is, what will hospitals look like by 2032? Let's look at that future together, slowly, clearly, and with compassion. Because this topic touches the deepest part of human life, our health. The first big shift is that AI doesn't diagnose the way humans do. A human doctor listens, observes, remembers, and compares. AI analyzes millions of medical cases in seconds and finds patterns no human eye can see. Imagine this. You wake up with chest discomfort. Instead of searching Google or waiting hours in an emergency room, you open your AI health app. It scans your face, listens to your voice, checks your breathing, and compares everything with millions of real patient cases. And in less than 10 seconds, it tells you whether it's heartburn, anxiety, or a serious heart condition. Now, why is this possible? Because AI is built on pattern recognition, and the human body is full of patterns. In heartbeats, in blood tests, in breathing rhythms, in temperature changes. Neuroscience shows that humans miss up to 15% of visual details during diagnosis. AI misses almost none. But does that mean doctors disappear? No. It means doctors will lean on AI the way pilots lean on autopilot. The human stays in charge. AI handles the complexity. The second big change is personalized treatment. Today, most treatment plans are generalized. Two people with the same illness often get the exact same medication. But your body isn't like anyone else's. Your genetics, sleep patterns, diet, stress levels, they create a completely unique health fingerprint. AI studies all of that. Imagine a diabetic patient who keeps struggling with unstable sugar levels. Instead of guessing doses, their AI doctor predicts spikes before they happen, adjusting diet recommendations and medication timing in real time. It's like having a personal medical guardian that never sleeps. This works because AI can monitor thousands of biomarkers at once, something no human can do mentally. That's why by 2032, one-size-fits-all medicine will be gone. The third shift is early detection, the most life-saving change. Right now, many illnesses are discovered too late. Cancer, heart disease, neurological disorders, but AI is catching them months, sometimes years, earlier. I once read a case where AI detected breast cancer from a scan 6 months before any human radiologist saw a problem. Imagine what happens when this becomes normal. Think of AI as a microscope for the invisible, a tool that sees danger before you feel it. This doesn't replace doctors, it empowers them. The earlier the detection, the simpler the treatment. The simpler the treatment, the more lives saved. Fourth, AI will transform hospitals themselves. By 2032, hospitals will look less like crowded buildings and more like intelligent centers where everything is connected. AI will manage patient flow. AI will track hospital infections. AI will monitor ICU patients every second and alert nurses instantly when something changes. Imagine a nurse who no longer runs from room to room trying to guess who needs help first. Instead, an AI dashboard highlights the most critical patients in real time. This reduces burnout, improves accuracy, and saves lives. Hospitals won't be quieter because humans leave. They'll be quieter because chaos leaves. The fifth transformation is robotic assistance, not humanoid robots replacing doctors. That's not the future. Instead, robotic precision tools that help surgeons perform near-perfect operations. A surgeon guiding a micro-robot that removes tumors too small for human hands. A robot closing incisions with flawless precision. AI monitoring blood loss and adjusting instruments automatically. This is already happening, but by 2032 it will be standard. Because the brain gets tired, hands shake, stress builds up. AI doesn't get tired, it only gets better. Humans bring judgment, empathy, and creativity. AI brings accuracy, consistency, and speed. Together, they become something unbelievably powerful. The sixth big shift: AI emotional care. It may surprise you, but loneliness and mental stress often worsen physical illness. Patients want someone who listens, someone who doesn't rush. AI health companions will fill that emotional gap. A gentle voice checking on you, a reminder to breathe, a suggestion to walk, hydrate, or sleep earlier, a guide through anxiety or pain. It won't replace the warmth of real human care, but it will support people during hours when no doctor or therapist is available. And for many, that support will be life-changing. This happens because AI can detect stress in your voice, posture, or even typing speed, a skill many humans rarely notice. Finally, the seventh transformation: home-based hospitals. By 2032, many homes will have medical-grade sensors and AI monitoring tools, mini scanners, smart mirrors that check skin and eye health, wearables that track heart and lungs, AI assistants connecting all of it to your doctor. Instead of going to the hospital will come to you. Emergencies will drop. Checkups will become virtual. Patients will recover faster in their own environment, surrounded by comfort, not stress. Think of it as healthcare becoming personal instead of institutional. So will hospitals look the same in 2032? No, not even close. They'll be smarter, faster, calmer, and more humane. Not because AI replaces humans, but because AI removes what makes healthcare difficult: delays, confusion, burnout, and human error. The future isn't about choosing between humans and machines. It's about giving humans better tools so they can save more lives. And if you feel uneasy about AI stepping into something as sacred as medicine, remember this: the goal is not to replace the doctor's heart. It's to support it. It's never too late to understand how these changes work, how they affect your life, and how you can use them to protect your health. Awareness is the first step toward embracing this future, not with fear, but with clarity. Because the more we understand AI, the safer, healthier, and longer our lives can become. Because the more we understand AI, the safer, healthier, and longer our lives can become. If you'd like to keep learning with us, make sure to subscribe.